Buenas tardes. Después de 3 días de inmersión y mucho aprendizado, creio que todas as pessoas acá estão refletindo muito e há brainstorm para a implementação da prática diária em seus centros de trabalho. My presentation is about standardization for documentation protocols in the Cleft Centers as a key to have long-term follow-up and good outcome studies. How to scientifically contribute to cleft lip and palate treatment outcomes? We can consider many different approaches, and for research, we can include clinical trials, observational studies, case control, or systematic reviews. There are many types of research, but usually we evaluate the treatment protocols, surgical techniques, speed outcomes, orthodontic intervention, and others. And it's very important to have a collaboration with the team, because the treatment of cleft lip and palate patients, we need a multidisciplinary team, and the treatment outcomes need all the effort of the team. The outcome research, it's very important to have different kind of outcomes, functional, morphological, aesthetics, and the longitudinal studies, we need a good documentation to have a evaluation, and we did the measurement of this kind of evaluation also. And the technology we need to include to have a better forms of outcomes. We have some limitation when we do the treatment outcomes. For example, sample size is one of the limitations. It's difficult to have in one center very standardized sample. And many studies, we have a small sample size. And for example, if you see even the AmeriCleft or Eurocleft, each center presents a small sample. And then it's important to put many different centers to have a multi-center comparison studies, for example. The follow-up duration is important. Some studies is short, others much more longer. The design is important. There are many retrospective studies, and it's much better to do the prospective and randomized clinical trials. And the other limitation is the lack of documentation. We will talk about this in another slides, but we need to standardize the timing, in what age, in what phase we need to do the documentation. And there is the selection bias also as a limitation of the treatment outcome studies. And what kind of documentation, what kind of record is needed to conduct the longitudinal outcome studies? What is the minimal records? Because we know that there are many different levels of centers, centers that present many difficulties to have a team to treat. And of course, every center would like to, uh, to offer the best practice and best results for our patients. Dental models or intraoral scan, facial and intraoral photos, lateral ceph or cone beam CT, periapical for evaluation of bone grafting and facial growth, um, for evaluation of speech, videos or records. I think this is the minimum records to evaluate the function, aesthetics, growth, and others. According to Peter Mosey, there is a minimal age and minimal records to have a good practice. For example, before and after primary surgery is essential, the records. 5 to 6 years for speech, for example, before maybe 3 years old, and 5, 6 years for study models, photos, between 8 to 10, between 10 to 12, we need to record the before bone grafting phase, after bone grafting phase, and the continuing orthodontic practice. And in the end of treatment, I think this is the minimal record we need. Yeah? Then the photos before and after surgeries, intraoral scan or models is very important. We can compare size of cleft before primary surgeries, and we can consider the growth using the proper outcomes measures. For example, Gosling or ATAC is one of the measurement, and the facial and nasoalveolar aesthetics index is a good scale to evaluate the how is the improvement of the facial appearance. Yeah. Yeah. The documentation and the minimal age to do the documentation. Yeah. The Gosling yardstick for unilateral, and for bilateral, you can use bilateral yardstick for 6 years old, 9 years old, and in the permanent dentition. Of course, X-ray is important to evaluate and to compare the evolution of the treatment. And one of the research that we learned a lot was this about randomized clinical trial to evaluate speech and growth. And after this study, we learned how important is the documentation in our practice. Because without the documentation, we can't do any evaluation after. And then I think the standardization for documentation protocols in the Cleft Center is essential, is a key to have long-term follow-up and to have good outcome studies. And we can evaluate the effectiveness of the treatment protocols audit in our center. We have the experience to start a Brazilian national multi-center study. We evaluated first the growth, but the pandemic phase, we have many limitations because we started in 2019, and in the exact moment of pandemic. And we have 40 medical partners of Smile Train, but only 7 centers could participate in this study. The objective was to propose a national evaluation of cleft care among the reference centers in Brazil by comparing maxillomandibular relationship. And we observed the different surgical techniques and approach that center used in the sample. And as I told you, from total of 40 partners, 15 partners participated in the first meeting, and 7 centers were included in the study. And what were learned based on the initiative of these multi-center collaborative studies? The multi-center was important to stimulate, to review the importance of the records for each treatment phase in the center. It's important to review the treatment protocols in each center and to check the effectiveness of treatment. And important to stimulate future multi-center collaborative studies in Latin America, in Brazil and Latin America, and to stimulate multi-center randomized clinical trial. That is much more difficult, but it's possible. Yeah, thank you.